Despite advances in medical technology, blood remains irreplaceable. Before 1974, Taiwan's clinical blood supply was almost entirely reliant on paid donations from professional donors, which made it impossible to effectively prevent the spread of infectious diseases. The Taiwan Blood Donation Association was established on April 19, 1974, through the joint efforts of charitable organizations and various sectors of society committed to public welfare. Since then, Taiwan has gradually moved towards an era of voluntary non-remunerated blood donations. After the association was established, blood centers were subsequently established in 6 locations: Taipei, Taichung, Kaohsiung, Tainan, Hualien, and Hsinchu. Efforts to promote blood donation were actively carried out across Taiwan. To enhance the efficiency of blood donation and supply, the number of blood centers was later reduced to 4. Since 1991, blood donation in Taiwan have collected 1,066,082 units of blood. The national blood donation rate has reached 5.18%, making Taiwan one of the world's leading countries in blood donation efforts and receiving the ISO 9001 certification in 2001. Taiwan's supply and service quality of blood donation has reached international professional standards. Over the past decade, the national blood donation rate has remained above 7%. The blood donation movement has garnered strong public support in Taiwan. Currently, the total number of donors has reached 8 million. This means that roughly 1 in 3 citizens have donated blood. As long as you're between 16 and 70 years old, above a specified minimum weight, and meet the relevant criteria, you're able to donate blood. Blood donation can be divided into 5 steps. 1. Verify identification documents. 2. Fill out the health questionnaire. 3. Interview and physical examination. 4. Donate blood. 5. Rest. After donated blood, the blood bags are returned to the blood centers. They must undergo blood component processing and leukoreduction filtering to produce various blood components. After, blood testing, verification, and automatic labeling are conducted before supplying the blood to hospitals for patient transfusions. To ensure the safety of patients, every blood donation must undergo rigorous routine testing. We utilize automated testing equipment, including performing tests for A, B, O, and Rh blood types, as well as conducting various additional tests. For example, irregular red blood cell antibody screening test, alanine transaminase, serologic test for syphilis, hepatitis B virus, hepatitis C virus, human immunodeficiency virus, human T lymphotropic virus, and nucleic acid amplification tests are conducted to take the strictest measures to ensure blood safety. Since 2013, NAT has been fully implemented for all donated blood to help reduce the risk of transfusion-related infections. The testing operations for all blood centers are centralized in our Taipei and Kaohsiung blood centers. More than 6,000 donor tests are conducted daily through fully automated testing. The test results are transmitted to each blood center via a dedicated online system. We also provide regular blood donors with additional healthcare services as a reference for self-health management for blood donors. The health checkup services are conducted for blood donors every 3 years, covering tests of total cholesterol, LDL-C, HbA1c, and abdominal ultrasound. On September 1, 2009, we launched the nation's first automated low-temperature specimen storage facility. Through specimen storage, each bag of blood can be traced, enabling retrospective investigation of transfusion-related adverse reactions and facilitating tracking and detection in response to emerging diseases. This further enhances transfusion safety for patients. In 2020, a laboratory for detecting emerging infectious diseases was established at the Hsinchu Blood Center. Monitoring programs can be activated immediately in the event of an outbreak, and emergency response mechanisms have been implemented to ensure transfusion safety. We supply whole blood, leukocytes-reduced RBCs, washed RBCs, apheresis platelets, leukocytes reduced to apheresis platelets, fresh frozen plasma, cryoprecipitate, and white blood cells. The plasma-derived medicinal products is produced using advanced manufacturing processes by CSL Plasma Fractionation Factory in Australia, including Albu RX20 TW solution for intravenous infusion, Privigen TW solution for intravenous infusion, and high-purity factor 8 von Willebrand factor concentrate. We have also established a rare blood type registry with records of all rare blood type donors maintained, and the donated blood components are frozen and stored properly. Hospitals without their blood banks must personally collect blood components from blood donation centers whenever needed. Blood centers will deliver any required blood components via cold chain logistics to hospitals with blood banks, ensuring they are readily available for patient transfusions. The system is also connected to a blood information management system with expanded functionality for remote hospitals, allowing them to order blood components through the platform. With the increasing awareness of sustainability, we are actively engaged in enhancing information security by obtaining ISO 27001 certification. Our goals include digitization, paperless operations, automation, and continuously improving services for blood donors. To expedite the delivery of test reports to blood donors, we utilize digital platforms such as email and a donor section on our official website to view test reports, in addition to providing printed reports. In 2016, we launched the iBlood official account online app, which allows users to check blood donation locations and access information related to diseases, surgeries, and medications. Once linked, users can receive blood donation reminders, test report notifications, and view their next eligible donation date. A safe inventory level of blood components should be maintained for more than 7 days. An inventory of 4 to 7 days is considered low, while anything below 4 days is classified as a critical level. The Foundation's official website features inventory level indicators, allowing the public to view the available blood stock at each donation center. In consideration of declining birth rates, it is essential to both increase the supply and optimize the management of medical blood usage. The Handbook of Precise and Practical Blood Transfusion was newly compiled and published in 2020. The content was compiled and reviewed by a team of professional physicians focusing on common indications across various specialties. It introduces guidelines for appropriate blood usage to provide clinical physicians with further treatment considerations. Dozens of blood donation events are held daily across the country. These events are organized by all sectors of society, including businesses, community organizations, schools, and military units. They actively promote and solicit blood donations, providing resources and encouraging the public to join the ranks of blood donors. These services have expanded to various towns and communities. In addition to blood stations in Penghu, we also organize offshore donation events in the outlying islands of Jinmen and Matsu, ensuring that there are no barriers to blood donation. Taiwan's temple culture is truly unique. In central Taiwan, Zinan Temple hosts hundreds of blood donation events annually, transforming local religious faith into a force for compassion and creating a strong call for blood donations. As Taiwan's society continues on the trajectory of aging and low birth rate, the amount of blood donated by younger populations has gradually declined, despite Taiwan's top global blood donation rate. To help the younger generation better understand knowledge related to blood, we published Taiwan's first illustrated book in blood science titled The Children's Illustrated Guide to Blood. Using a visually engaging and easy-to-understand format, the blood helps teenagers learn about blood science and the importance of blood donation. While the entire world shifts towards green energy, Taiwan Blood Services Foundation began years ago to gradually replace fuel-powered blood donation vehicles and introduce electric power at newly established donation locations. The initiative aims to reduce emissions, lower the air and environmental pollution of blood donation vehicles, and provide a more comfortable environment for donors. The Foundation actively partners with enterprises and organizations to promote the use of electric-based blood donation vehicles in place of fuel-powered ones. This transition aims to reduce noise and emissions generated by blood donation, creating a more environmentally friendly atmosphere. Taiwan Blood Services Foundation, a medical nonprofit organization, is dedicated to ensuring blood safety and balancing the supply and demand of blood. It provides safe blood components for patients and enhances services for blood donors, becoming a rock-solid support for the public's health and clinical needs. Donating blood and saving lives is a mission rooted in sustainability. Happy blood donation and safe blood use is the perpetual objectives of the Blood Donation Initiative.